Welcome to Discover Health, a White Mountain perspective. I'm your host, Dr. Tom Barela. Today's program deals with a subject that really touches home to all of us, stress. I know a lot of people out there don't have stress, but most of us really do. Sometimes it's very difficult to deal with, and myself as a physician, I frequently recognize stress, but have a difficult time treating it. Our guest today, Dr. Jose Garcia, a psychologist in practice in Pine Top, actually treats this, frequently helping many people. Welcome to our show today, Dr. Garcia. You can say good morning and stuff, and I'll take that. Stress is a big problem for a lot of people. Can you talk to us and get us started a little bit and tell us a little bit about stress, how it occurs, and maybe how it affects our daily lives? And I know that you have an approach to treating stress, approach based on mindfulness, which is one of the spectrum of cognitive behavioral therapies. Can you give us a background of how we're going to do our show today?
Well, obviously, I'm a little bit stressed right now because here we are in a what I would call a performance-based venue, as opposed to a learning, although certainly we want to learn from this experience as well. And I want to start by saying thank you for having me and allowing me to, this is not about me, this is about promoting a what is become mainstream therapeutic practice or intervention, as we call it. And there are many ways of treating stress, but I have found that that it's very much aligned. Mindfulness, as we're referring to the concept of mindfulness, and we want to probably give a definition, which we'll get to it in a second here. And let me just go ahead and mention it. But the famous, most common definition of mindfulness is a paying of attention at the present moment in a non-judgmental way, purposely, intentionally, into being here and now.
Okay.
Stress, which, by the way, happens to come from, it's not just a medical term, it's a term that has come from really the manufacturing material world. When a machine is run, it has stress. There's stress put onto the metal, to the steel, and that stress, if not maintained, will wear it out and will crack. And so we have. Well,
that's an interesting analogy to us human beings. I didn't think of stress as me cracking, but it sounds like a good analogy.
When we're feeling overwhelmed, we feel like we're gonna crack, or we're feeling broken. And I say to my patients, there's more right with you than wrong with you, and this is a treatable condition. But back to the mind is that the stress is causing distortion in the cognitive function, in the thinking. Stress causes distortion or unhealthy moods and stress, and this is why it's difficult to treat, because it's all inside, and we don't have a machine like an MRI that we can go in the body and say, oh, there's a tumor in there. Okay. However, we can go now with the different scans to do the brain scans and see how the activity of the brain. We all suffer stress, and I don't know if I'm maybe overstating, overemphasizing the topic of just what stress is.
Well, I noticed on one of your slides you talk about survival, and the brain is hardwired for survival.
Yes, and so we are constantly scanning our environment to see if there's a bear coming in our to partake of our barbecue, or a tiger.
That was, for those of you, that was a story I just told before we got on the air. Actually, it's probably more like an auto accident or something coming down is more appropriate.
Right. But the modern stress is not, although we have bears and bobcats and dangerous animals, especially living up here in the White Mountains.
Yes.
But in the city, in the modern world, our stresses are coming from relationships. The difficulty of marital or just relationships between mother and daughter or father and son or in relationships at work. They're coming from not having harmony and difficulty in communicating and so forth. We get stress from the job itself, having too much on our plate to do, deadlines to meet and so forth. We have stress from just from physical illness, which is what you have spent your life helping people, and that causes stress as well, because they begin to worry. So stress is worry is part of the stress, and when it gets to be excessive and severe, it can move into anxiety. And we all experience anxiety. We all experience depression, and so. The modern stress is the troublesome brain, that these are perceived threats, and we have to learn then to teach our patients, treat them, to help them reframe the stressors. Okay, so there's stress and there's stressors. There's specific stressors. So one of the key questions we want to ask is, well, what's stressing you? What are the stressors in your life? Stressors.
What turns you on? Makes you have more stress.
Makes you worry. Well, I'm worried about the fact that I can't find a job. They'll tell me I'm stressed out because my son is in the hospital with colon cancer. Well, and so there are sort of worries about people who care. It's usually there is some caring involved, or there's a goal that's not being met. So our brains are hardwired for survival. It's also they're wired, or there's a connectivity to think about the past. Okay, we have a memory, and we also have the ability to project ourselves into the future. So mindfulness is a way for us to center and ground ourselves in the present moment. And in doing that, just that very simple act of sitting and breathing, that's the most simple way that I can explain what mindfulness is, because it's gotten to be where we really know a lot about the complexity of mindfulness, and we've gotten away from the Himalayas and the Tibetan monks and brought it into our workplace. We've brought it into the medical arena. We're bringing it into education. We're bringing it into both clinical. In the mental health field, as well as the physical, the neurology of mindfulness.
And you're, by mindfulness, you mean being aware of your current surroundings and dealing with them?
Well, there's two aspects to mindfulness, in broad strokes, we're going to say, is one is what it's called referred to as the formal mindfulness, sitting and breathing, often referred to as meditation. And it's not necessarily just Buddhist. It's not necessarily just a Zen thing. It's because all religions, if we look at all religions, and I have looked at not all of them maybe, but the main ones, the top 8 or 10, they all have a form of meditation. For example, in Christianity, they call it reflective prayer, or
essentially slowing down
and meditating on, say, the cross, or
okay.
Okay.
Right, well,
so that's a religious.
So there's something that needs to slow down, whatever the mechanism is.
Absolutely. Slowing down. In fact, that would be probably the first thing, is slow down and turn the switch off.
Well, I know the current fad, at least in Phoenix, is these deprivation float chambers where they put you in the dark and stuff. And I'm not sure that helps you solve anything on the long-term step, but it's really pretty neat to be floating in the dark.
When the idea is that when the body is, and we pay attention to the body, when the body is allowed to rest and relax and be comfortable, that's the first step to self-regulation.
And the second step that you were talking about?
Well, the second step is what I was going to say is that that's the formal, where you sit, you slow down, stop, and breathe. But then there's the mindfulness that you were referring to. That's a daily, everyday life mindfulness, being aware of what we're doing at the moment.
I see.
For the machinist, that would be paying attention to what he's cutting or drilling or welding. For the, let's say, the teacher is to be present to the subject matter and making sure that the students, for example, are really all mindfully paying attention to the lecture or the tape or the book that they're reading or the written expression they're trying to do.
Whatever activity.
Whatever it is. Yeah, and we can do that when we're cooking, when we're hiking, we're fishing. Mindfulness in the moment. And we all really do a lot of that. A lot of that. In fact, why do people go out and golf and hunt and fish? It's because they get out and they take their mind away from their daily stressors, we call it. But it's their job, their daily, what they do in life. And so they say, well, that's my therapy. That's my form of therapy, is golfing or fishing. Because they're focused on, casting or
something that isn't
driving.
stressful.
And it's fun. It's enjoyable.
So that's the first part.
That's the mindfulness in daily living.
In the daily
In the daily doing, and we can all do that immediately, right now. Now, the problem is that we are often, let's say, a woman, a mother, a wife cooking in the kitchen. If you can imagine that person doing one of the most important jobs there are, in my opinion, and they're worried about something about their children's, her children and their children, her husband and her, who is having difficulty at school. The child has ADHD. He's been diagnosed with ADHD, attention deficit hyperactive disorder, as you know. Mindfulness has been proven now to help with that. Why? Because when we sit and meditate in a formal meditation, formal mindfulness, we are focusing our mind on the breath. And what's going to happen invariably, and you probably have tried this, the mind is going to go to something in the past and starts ruminating to something in the future. If I sit here and I close my eyes, or you sit here and we both close our eyes, your mind is going to go to the past or to the future. And you're going to leave your body and leave the present moment. So what we do in training in mindfulness is we're going to ask the person to say, when that happens, which is going to happen, the mind likes to be stimulated and it likes to go to the past and to the future and ruminate and worry and think and plan and so gently be aware of that. That's a mindfulness moment. I'm aware that I'm stressing over something, and I'm going to gently, with self-compassion, loving kindness, bring myself back to my task, which is to breathe, to pay attention to my breathing. Because really, we don't have to make our lungs breathe. The lungs breathe.
It is an autonomic process.
It's an autonomic process.
Good thing too.
It's a good thing, yeah. And so in our first part of the training, we say, bring yourself back to the breath, And then I will say, when I'm teaching this to my patients, I will say, just listen to my voice and I'll guide you through it. I enjoy breathing in and I enjoy breathing out.
Well, you see people in a lot of stressful situations, they tell people, slow down,
and breathe.
Take a deep breath.
And calm down.
And then go forward.
And go on.
Now, before we go further, you need to describe the term you use, rumination, because I know that that's a significant piece of recognizing what to do with stress.
Yes. Rumination is really a repetitive mindset of worrying about something over and over and over again. Staying, basically carving a Grand Canyon in your mind about some worry or some concern. So it's we call it rumination, and it's almost an obsession, a form of obsession.
You can't let go.
And I can't let go. Okay. And I just can't help. I can't stop thinking about so and so. I can't stop thinking about such and such, and it keeps me awake at night. Okay. So now here we go. So let's practice mindfulness when you can't sleep. Let's practice. Let's go do some formal mindfulness. Get yourself into the present moment and focus on your breathing. So it gives the breath is the anchor.
Okay. So the rumination, the not letting go of things, frequently is what leads people to somatic complaints, and the stress, which is the science of stress behind it, and all the complaints that I know you have on one of your slides, the next slide, which we probably will go through quickly, but it basically is the types of things that I deal with, which are the increased heart rate, increased blood pressure, upset stomach, sometimes sweating, sometimes diarrhea.
Yes.
Probably, a lot of children deal with these types of things too.
Yes, and we call it, you know this, doctor, somatization.
Right.
Right. So that the rumination, the obsessive compulsive, the obsession of
Right.
what we're thinking about over and over again, when it's chronic, then it causes a soma, an ailment in the body. For example, diarrhea. Somebody who is very, very nervous about school, a child who is very nervous about being with their peers and in a big school. When I was a teacher in California, for example, counselor in California, and I was at Grover Cleveland High School, 4,000 students, community college, and children have to deal with that. And not all children are extroverted and assertive and so forth. But so the somatization is what we see. So that's where the 80% of ailments in doctors' visits are stress related or enhanced by stress.
And we can't discount that as a time. So let's go on, and because I want to make sure in the time we have left we get to how you deal with it. So the next slide, it talks about the definition of mindfulness, and you really have already talked a little bit about that.
Right. In the Buddhist philosophy and in Buddhist psychology, which I'm starting to study more and more to bring it into the Western science, we hear the word things happen, and there's other more vernacular, funny ways of saying it. Things happen. Or it is what it is.
Yes,
it is what it is. And don't judge it. It's not bad. It's not good. There's the story of the farmer, right? Who had he lost his horse, and his horse left, and the neighbors came back and said, "Well, I'm so sorry, Fred, about your horse." And he said, "We'll see." And then a couple days later, the horse came back with 10 other horses. And neighbors came back and said, "How fortunate, Fred! You now are an owner of 11 dozen horses." And he said, "Well, we'll see." And the story goes on like that, where the son rides the horse, breaks his leg, and the army comes over to do the recruiting they're at war, and the son is exempt from going into the military because he's got a broken leg. Right. And the idea is that it is what it is.
Right. So let's go on. If I come to you as a patient, my doctor says to me, "Dr. Barela, you're really stressed about your job. You really need some help dealing with this." Give us an idea of what you do in mindfulness in the period of time that we have left.
Okay. So after doing a clinical interview, about what we want to do is I want to identify and help you see clearly what are the stressors, what are the triggers. We call them triggers also.
Okay.
And then once you identify that, then we want to then say, okay, now let's go ahead and I will do a little cognitive behavioral therapy, and I will explain to you, if you don't know, that thoughts lead to emotions, and that emotions lead to behaviors, and or somatization or sensations. So if you're thinking about something that stresses you, you're going to have an affect to it. You're going to have a reaction, an emotional reaction to it.
So are you saying my thoughts,
Yes.
whatever it is, it's maybe, I don't know what the thought, whether it's going to lead to an emotion, and that may be an okay emotion, or it may be a bothersome emotion,
Yes.
and stress.
Distressful.
And if it's an okay emotion, I let it go, like I did with my phone here. But if I can't, it leads to stress. Is that what you're?
It leads to to stress. Now there's going to be the anxiety or nervousness or discomfort at a mild level, because we're going to have either mild, moderate, or severe levels of stress. And chronic stress, as we know, is very damaging to the body physiologically.
Right.
But we want to say, all right, so what do you do? And you say, well, I go and I eat. Oftentimes people use food as comfort. And
Right.
in fact, we have now call it comfort food. and it's really junk food, right?
I never told people I got overweight by eating right.
Exactly.
Okay. So what do you? So part of what you do is have people recognize these triggers.
So I'm going to ask you to identify the stressors. I'm going to go through that model of cognition, emotions, and behaviors or actions. And I'm going to say to you, now for the next week, I'd like to see you for next week, but I want you to take note of what it is you're thinking, your thoughts, list them, the emotions that are elicited, and I'm going to ask you to say also to please journal what it is that you do, and bring that back to our next session. And so when you bring it back, then I'm going to ask you to teach you, show you how you can intervene at the thought level, and that's what we call reframing. Instead of saying nobody loves me. And so how can we reframe that? And I'm lonely, and nobody loves me.
Poor me.
Nobody calls me, and I'm feeling pity. I'm feeling bad. I'm feeling depressed. I isolate. I go and eat more junk food. I stay in bed. I call in sick. I don't go to work. I become self-absorbed. And that might not be your behavior, but I'm saying that as an example. And we're going to say, let's intervene you have the power, the choice to intervene. You don't have to wait till you come back next session to see me or call me because it's not a crisis. Call me if it's an emergency. Yes, I do want you to call me. And here's my cell number. But I'm going to ask you then to be your own therapist in a way, and say reframe it. So I'm going to teach you to reframe it and say, now there are people who have not called me. For example, my sons haven't called me in a month, and I'm going to say, well, but I have. That just means they're busy with their life, right? So now I'm reframing or putting justification that they haven't called me, not because they don't love me, but because they are simply doing.
And that's a significant change from your initial description.
Right, and now I don't feel unloved by them. It's just that now I have reason to say, and that's a good thing that they're doing their life. That's what I taught them to do.
So this is kind of
So,
like a recognition feedback.
A recognition feedback, and now I'm self-regulating, and now I'm not isolating. Now I'm not going to say, and you know what? Is since they haven't called me, the action is, what's the logical action? Because this is all rational and logical. It's rational emotive therapy, going all the way back to the early years. I'll call them. Why don't you text them and call them?
I guess that's
right?
I guess that's a possibility.
I'm sitting here waiting for them to call me, being self kind of arrogant here, being the father.
Well, I think it's important that you recognize the feedback loop.
The feedback loop.
So you send people with recognition, you
Yes.
send them out, and they come back
Yes.
to you
Yes.
and go through these things.
Yeah.
And the reason why I'm doing this is because we're almost done.
Well, no way. Well, let me finish. Let me
No way.
let me work in. Let me work in.
Well, you don't.
the-
You're almost out of time, so
let me work the mindfulness in, because
Okay.
the third time you come back to see me, because I'm just
Okay.
using your example. Now I'm going to say, now there's a way for you to intervene in a very natural way,
Okay.
and that is mindfulness. And then I'm going to teach you to do that. So I'm going to say, now go ahead and close your eyes, and I'm going to lead you through it. And if you want to do this, you can. You can do it with your eyes open. And I want you to focus on your breath. Breathing in and breathing out.
Okay.
And I'm going to wait. And I'm going to wait a minute or so.
You don't have a minute.
But I'm going to say, then I'm going to say to you, if your mind has wandered, which it likes to do, bring it back gently to the present moment, here and now.
Oh, I see. Okay.
And bring yourself back to the present.
All right.
Now, when you do the mindfulness practice, and I'm going to assign you to do 8 minutes for the next week every day, 3 times a day if you can. And if you can't do 3 times a day, do 2 times a day. If you can't do 2 times a day, do it 1 time a day.
Okay. All
But
right.
every day. And now we have now began to put the intervention of mindfulness, which is very close, like you said earlier in the show, Dr. Barela. It's cognitive emotional behavioral therapy. And now we've got self-regulation going, we've got focus going, we've got self-compassion going, we've got loving kindness going, we have increased patience, and that's what mindfulness is showing to have these beneficial effects in the clinical area.
Well, you've heard it now. It really is important that people understand that many somatic complaints can't be treated by a physician with medicine. A lot of it needs to be treated, as you heard Dr. Garcia talk about an approach to life. And mindfulness is one of the cognitive behavioral approaches to life to help us deal with it through intervention by someone who understands it. I hope that this has not been a stressful show for you, and I thank you all for watching. Have a great day. Thank you.